So let me put this in context. So you all have been on this journey with me for a little bit now. We started this in the winter where we really tried to understand how PFACs were functioning and what they need, and we created this online community. And right now I'm trying to make the community valuable to PFAC members and leaders of PFAC so that they see the community as a tool for them. So one of the things I'm being asked to do is I'm being invited to some of the PFAC meetings to help PFAC members learn how to use. So we're actually booking some meetings in computer rooms for some PFACs. This one, next week, they booked the computer room in Charterhouse. And I'll go to that PFAC meeting at Charterhouse's computer lab and help them try to get on the community. And I've created this, I call it a primer, on the community. And I'd love to show it to all of you. I don't know if any of you have joined the community or not. Yes, you have, okay. And I'd like to get some feedback from you. One, do you think this would help you? If you haven't joined the community, does this explain it after I go through this? And if there's a void, give me feedback so I can build this primer a little bit better. And then what I'd like to do is send it to all the PFAC leaders to send to their members, either invite me to a meeting and I'll step through this with your PFAC, or share it with your PFAC, see if this helps people understand how to get on the community. So I'll just go through this presentation, and I actually, before I go through it, Shonda, how about you hand these out? I printed out each slide. You can maybe make notes if you want. After I'm done, you can call up on this slide, I had a question, or you could clarify this a little better. But I tried to make this very visual. Sure. You can have a mic.
This is going to sound really negative,
Okay,
and I don't mean it to,
I know.
but we had this Yammer experience once.
Yeah?
Whatever happened to that? Aside from I found it extremely difficult to get on it.
Well, if you found it difficult to get on it, that should explain what happened to
Yeah,
it.
but I mean, that was probably just me. What about anybody else? Did anybody?
No. I think there are some people that see value in Yammer, and some people just don't. It's like Twitter. It's Yammer is a social media tool that a lot of corporations use internally inside their firewalls. And so that's probably why the first attempt was to do a Yammer. Because if you could create a Yammer group, it's very simple, but some people don't like it. And so we're iterating. So they tried Yammer, and it sounds like it didn't take off. I wasn't here when they did Yammer, but I can tell you I use Yammer internally at Mayo Clinic. I'm a member of many groups. But I know maybe 10% of Mayo Clinic's employee population uses Yammer. Out of 60,000 people,
Okay. So then now
this is different than Yammer.
and how is it different? I guess,
That's what I'll show.
okay.
So we have to try things different. But what we heard when we met with our PFACs and when we did a survey this winter, what we heard consistently is PFACs do not know what each other are working on. They needed more communication among PFACs and with Mayo Clinic. We also heard that the internal website and Yammer didn't work, and that there was a desire for an external community. So we created this external community, and this is a primer on the community. So you're perfect to listen to this talk, because if I haven't sold it to you after this talk, then I haven't done what I'm trying to do. So, from your search engine, any search engine, type in Mayo Clinic Connect. That's it. And here it is. Now, if you've never joined this community, It says not a member, join here, and I've circled that area. You can create an identity with your own email and a password, just like other things. Or if you are already on social media, you can join using Facebook or Twitter. And basically this primer, page by page, is going to have my talking points, so I don't have to be in your house with you. You can print this out and use it as a reference tool. Now if you click that box, remember me, if you're logging on at home, every time you log on, my computer remembers me. So it's hard for me. I actually had to run around today and ask my coworkers, are you a member of the Connect community? Because if you're not, you're perfect. I need you to try to get on so I can get a screen grab. Because I can't even get on my computer without it knowing who I am, and I'm automatically in the community. So on the right-hand side of this community are many, many patient groups. They're very based on conditions and things like cardiology, cancer, but we've created a group for PFACs. So you just need to look, and they're alpha ordered. They should be going down. Are you tracking? Okay, no. Here, I'll go back. Okay, are you there? Now I'll hit the next one. And I think they're going up and down, right? So here's me again. So here's the view of all the communities, and they're alphabetically ordered, and you just have to click on the PFAC group, and the button's quite obvious. This is your community. Now within your community, this is what it looks like. And there are several tabs. There's a resource tab, and this is where I'm putting surveys and polls and the videos of these meetings. There's a place where you can ask a question. There's a place for discussions. Here's where you can see all the members, who has joined this community. And here's a tab that you can use to invite your friends. You can invite anybody else that you know, any PFAC member. And quite honestly, if you have a family member you want to invite to this group, this is an open community for patients that Mayo Clinic has created. It is HIPAA protected, but you're opting in to join this community if you join it. And people who are in this community, this is a community for sharing. You saw that a lot of these communities are based on conditions. So people with diabetes, there's lots of people in that group that talk to each other. So there's more information about this community at the bottom of the home page. So there's a little box at the bottom of the home page, and you can click anything that's blue. It's a hyperlink, and it'll take you to more information. Now, I clicked on the About Mayo Clinic Connect community, and I got a message from Dr. Tamimi. The Center for Social Media created this community for patients, and he has put in a little primer in there for patients to use if they want to join this community and learn more about it. Now, an added thing I'm going to share is we modeled our community after a very similar community that the Institute for Patient and Family Centered Care has created. Now, I don't know if you've all heard of this group, but if you type in Institute for Family and Centered Care, you'll get to this website. If you go to Tools for Change, you will see their national PFAC network that is open to any person to join. A very similar model of how to join. And I'm just going to call out their discussion forums. You can see a very similar pattern here of discussions, groups, chats. Their discussion forums have things like 88 topics, 521 posts. patients who are PFAC members from around the country are on this community sharing ideas with each other. And so we basically created this community for Mayo Clinic PFACs to share across Mayo. A larger national community exists for PFAC members. We've just created one just for Mayo. So in summary, these are some of the points that we want the leaders and the PFAC members to know. That this community is created for you. It was created after feedback that we heard from people. The goal of this community is to improve and enable communication and idea sharing across PFAC and with Mayo Clinic project teams. The idea is when staff starts to learn that this community is out there or on their own, they're going to get in that community and post questions. That's how a community should work. And the beauty is these communities, when they start to get active, an automatic newsletter is going to be generated every week. So if people are posting to it, you'll get something in your inbox telling you these are conversations that just started, or people are responding and talking. But right now, because people aren't joining and not posting, that newsletter is not happening. But that's okay. The newsletter will happen. When we created a community for the Transform Symposium, it took us about almost 2 years before we got the momentum for a newsletter to generate. But that was very hard because these were people that came to a conference and then left, so they really just had to find the value. The bonus now is we are creating monthly channels, and we created this meeting in particular because, because I started getting phone calls and our office started getting phone calls from Mayo Clinic staff. Hey, I hear the Office of Patient Experience is working with PFACs. How can I get this project in front of PFACs? And so I would send an email out 1 week, and then 2 weeks later I'd get another request and I'd send another email out. And we know we need to funnel it more purposefully. So we created a monthly meeting so that Mayo employees, when they call me, I can say, we'll put you on the next agenda. But then we also, as Bob Dimmler, that many of you know, he was here last week, he brought up, how can we request people from Mayo to come to this meeting? And I think that's a very logical next step. But we need to slowly show that these meetings are valuable, and it'll start happening. I'm convinced of it. Word travels very fast in the institution. And I know you're probably going to tell 10 of your friends. So, did this help or no? Okay. But I'm totally open to hearing no.
I think watching everyone look through it, one big change that we can make before we go to the Charter House is we will number the slides for the order that she's presenting them, and we'll make them be read left to right.
Yes.
I think that'll help a lot.
Good point, Shonda.
So you would probably want us, before the next meeting, sign in and see what's going on.
I love it. And what I'll do is probably next week I'm going to write to all the PFAC leaders, because it takes me about a week to get these video recordings cut up and put on the community. But early next week you should get an email saying we've uploaded things, and when you get that, hop on, or you can hop on tonight and explore it. You are welcome to get on this community at any time. But I would like to start letting you all know when I make an update, just because that'll trigger you to, oh, let's see what you put up there today. But what's up there now, if I go to the community, so here I am, I'm in the community, and I'm scrolling for the PFAC group, hopped on, and it takes me right away to be engaged with PFACs. Now, you can actually, if you scroll, what I'm trying to do is clump them all by color until I have a little more of a web designer to make this better. I'm using color. So for instance, all our July videos from the July 8th meeting, they're all in this reddish color. And we started doing this in July. We basically cut up every presenter in the July meeting. We sliced and diced the videos so that you all can watch these videos of these meetings that some of you may have been at and some of you might not have. So last month's meeting, we had a great presentation from Dr. Morgenthaler and Bridget Griffin. So now, any PFAC member, whether or not they were in this Engage meeting, can watch this, and we're going to put tonight's recording on this. And this one's probably much longer than we wanted, but the sound's pretty good. You can hear and then if you go back, after the video is a survey. So you all can watch the presentation and answer the survey questions. And I'm going to do the exact same thing after this meeting, but it's going to take me about a week. The beauty is if we can show that people are using this, we might be able to justify a person whose full-time job is helping PFACs. Because right now, we're fitting it in among 15 people in the office. But you all know that story. But I also want you to know we see this site almost as an archive. For instance, if you scroll down, there are things here that we've put in so when Dave DeBronkart presented, he came in as a fellow at Mayo Clinic and he presented to the PFACs. We put that video here. When we did the April 6th PFAC leadership workshop, we've put all the summary reports here. So here is the all PFAC survey that you all received back in February. And I'm going to show you how slick this is. Because this is the summary slide that many of you saw when we shared it with your leaders, but you can actually turn the pages and see the responses. You can see it much better on your own computer. So we have all the information from the survey out here. So if I get hit by a bus, Shonda knows where it is. But that's how we want this to work. And so we also benchmarked with other organizations. I don't know if you remember that. So now all that information is here externally. It's not just in our internal website, but wait till you guys see this. And Shonda actually had part of this work. She was an intern in our office this winter, and she helped us arrange these benchmarking calls. So across the top, you'll see the organization that we benchmark with. You'll see who was on the line from the other organization, and the questions that we asked and the answers, and our notes. So we're being really transparent because we want the PFAC leaders to also see value in this tool. We want them to have this research, and when they say, I know we had this meeting back in February, but what did we talk about? This is a place for them to use as well. So it's a little, as it's being born, so it's a little messy. But I'm starting to see a pattern of things that we need to do. And I think the more we keep showing to you what's out here, the more interested you might become. And then I'm also going to call out something we added. So we had a discussion tab that I showed you. I created a discussion called Articles on PFACs. And I started posting a few articles when I saw them. And then we also just recently there was a webinar that we were able to get permission. Oh, I can't remember where I put it.
That showed up earlier in one of your slides.
A webinar? Yeah. I wonder, I'm going to have to look into that. I have a feeling, I thought I put it in the articles on PFACs, but let me go to the very bottom of that. Yep, this is it. So I recently participated in a webinar. Oh, I am so bad with acronyms. Communicating in Healthcare. something association about communicating in healthcare. But they gave a talk on partnering with patients to co-design healthcare and developing patient-preferred practices. Hello, who was just here presenting to us, Rihal? So I asked them if I can share this in our PFAC group. They gave me permission. You all can watch this now, as well as all the PFAC leaders. And it takes a little while. Come on.
Does it move faster when you talk to them?
It makes me feel better. Just be grateful. Well, someday I'll have to invite my husband so he can tell you how often I talk to myself.
We'll ask questions as we go. Which is the first question. If you go down to that right-hand corner in the chat box.
So once you get through the kind of housekeeping stuff,
Patients from the perspective of
you get to the
changing
talk.
healthcare experience from a human perspective and collaborative. Absolutely wonderful things going on. When we think about this, we see a lot of these human comfort.
That's all you're going to get, because now I want you guys to go out to the community and watch it. But this is an hour-long talk, and it's brilliant about how you bring patients in to create real patient-centered care. So we want to bring this community to life, and I know it's going to take a while. We don't want it to be a Yammer experience, because I bet you guys logged on Yammer and there was nothing there to look at. But if it's a rainy Sunday and you want to get on the computer, I want this to be a place that you think of. Well, let me go check this out. Let's see. And I'm going to do similar talks to the PFAC leaders, because if I can let them see the value, maybe they can start posting here as well, making discussion groups for your particular PFACs. And this community will really blossom if that happens.